Dave, you were reaching out to lots of different people, and I'm so glad that we were able to connect with our next guest, the Senator, Dr. Richard Pan, a pediatrician as well, just to educate us, to educate all of you, and to have questions that he can help answer.
Got to thank our city council person, the awesome Angie Ashby, for bridging the gap here and hooking us up with Dr. Pan, who is a hero of mine, has been for a long time. I followed his career and his work that he does. It's not often you can bring a guest onto the show that you can say has literally saved many, many lives, and it's our pleasure and honor to have him on right now. Dr. Pan, I'm Dave. That's Jason across from me. Thank you so much for coming on. I know you're busy. How are you doing this morning?
I'm doing all right, but everyone's working together to try to keep everyone safe, so I'm holding up at home right now.
Dr. Pan has agreed to come on with us weekly to talk to you, and if you have questions, whether you want to call in or you can text us at 441140. Doc, I'll start off with maybe one of the most common questions I hear, which is, and maybe this isn't put in the form of a question, but hey, we've had the Spanish flu, we had H1N1, we had SARS. We're fine. None of this happened before. Everyone's overreacting. Why is this not the overreaction some people think?
Well, actually, it's interesting you brought up the Spanish flu, which, by the way, didn't start in Spain.
Kansas.
But back in 1918, that flu killed more people in 1 year than all the soldiers, sailors, and airmen who died in World War I on both sides of the war. So certainly, we got through it. We will get through this too. But what we want to do is try to get through this without losing any more lives than we need to lose. And that's really what we're doing here today by asking people to stay at home unless you're doing essential services. We're trying to slow the spread of this disease so that we don't have so many people sick at the same time that we overwhelm our hospitals and our intensive care units and our healthcare workers.
Doctor, I'm curious about this actual virus in the different layers, because obviously the worst case scenario, we've heard about deaths being reported, but then there's also people that may have it that are asymptomatic. That's such a wide variety. How would you explain the differences of those two extremes?
Well, about 80% of people who catch this virus will either have very mild symptoms or not have any symptoms at all. In fact, we do know that many people who have this disease do not have any symptoms but are still infectious and can spread the disease. That makes it really challenging because that means that the disease is being spread by people who aren't sick. At the same time, what we do know is that this virus also makes people who are older, so particularly people who are above 65, so people who are over 80 years old, more than 1 in 7 of the people who catch it so far have died from this. People who are 70 and 79, you have an 8% chance of death. I would also point out that even for younger people, there's a fairly high rate of hospitalization. So even though people will survive, they need hospital care. And so that's the challenge. So yes, many people, in fact, most people this is not a big deal when they catch it. But for a lot of people, and when you have a virus that basically very few people have immunity to, because right now the only way to get immunity to this virus is to actually get the disease, then it tends to spread rather rapidly, and no one is able to, already has protection against this. So basically what would happen is as this virus spread without any effort to try to slow it down, we'd have so many people needing to go to the hospital and needing hospital care that we would overwhelm our hospitals. And certainly if the virus got to our seniors, but I just quoted the rates of death, we're going to have a lot of people die from this virus as well.
Dr. Richard Pan joins us, also state senator, answering your questions on all things coronavirus. Here's one I'll read you, Doctor, from right here in the 916. Dr. Pan, my job is making me deal with mail, and we haven't shut down. We have no gloves, no masks, nothing. Should I be worried?
Well, I'm not I don't think we've identified cases that have been transmitted through things like mail. It can get on surfaces. So, for example, you want to try to clean commonly touched surfaces like door handles and so forth. But, for example, things like food or mail have not been shown to be a source of transmission. I would make note that we tell people that try to avoid touching your face because if things get on your hands. But in terms of mail itself, I think it would probably be some prudence to say, let's say if you, if you wear gloves, you still can't touch your face because if it's on your gloves and you touch your face, that's how it gets in, right? So it's not so much about wearing gloves, it's about not touching your face. Hopefully you have available to you things like hand sanitizer, or more importantly, actually a sink and soap. That's actually more effective, although hand sanitizer is very effective, to basically be able to clean your hands frequently.
If I could just piggyback on that, I'm kind of a germaphobe before this. So what I begin to worry about is handling cash, hitting the octane button when I fill my car up with gas, pressing the buttons on an ATM machine, and of course, shopping carts or door handles. I will often put my hand in the sleeve of my sweatshirt and open it that way. But am I being overcautious? Much like you said with mail, are there any worries about touching any of those types of things?
Well, this is a brand new virus, so there's some things we don't know about it. However, I think some of the studies have shown that while the virus can live on certain types of surfaces, tend to be smoother types of surfaces, like metals or smooth plastic, things that are like paper or food or other types of things, it doesn't tend to survive very long. So, but as I mentioned, the most important thing is that whatever your hands touch, you don't want to bring to your face because it's not going to enter your body through your hands. It will enter it through your eyes, nose, and mouth. So if you are touching a surface like a door handle or a button that a lot of other people are touching, after you do that, you may want to wash your hands or use hand sanitizer so that you don't then touch your face before you've cleaned your hands. I think the most important thing we tell people is try not to touch your face with unwashed hands, and that's the way that you're more likely to transmit the virus. The main way people transmit the virus is actually through social contact, where it's through droplets, and that in terms of people being close to each other and then either sneezing or coughing or some other way of getting droplets into people. But also in terms of your hands, it's really about things that you touch and then not clean your hands before you touch your face. So try not to touch your face. I know it's really hard. A lot of times people do it without thinking about it. And that's why I tell people also to try to frequently wash your hands or clean your hands so that you do that before you accidentally touch your face.
Dr. Richard Pan with us. We're also taking questions on our text line at 441140. We have this one. Doctor comes in. If you get you kind of brought this up earlier, but if you get the virus and overcome it, can you get it again? Or do we know? Well,
there have been some, let's say, we don't think so. I say think so because we're still figuring this out. There have been some stories where it seems like people have gotten the virus, got over it, and then got it again. But I think a lot of people who are looking at those cases think that perhaps, for example, the test that they did, after they, quote, recovered, may not have been entirely accurate. This virus infection sometimes does go in phases, so that what someone might think is recovery wasn't necessarily full recovery. But the indications are, especially given the class of this virus, is that once you are truly over it, we believe you'd be immune. There is some question as to how long you are infectious. So when you recover, are you fully... also, are you able to transmit the infection after you've recovered? And I think we're still trying to figure some of these things out.
Dr. Pan, when I first fell in love with you and your work, it was in regards to vaccinations. I'm very passionate about that, as you are, obviously, and have saved many, many lives. In reading about it, I began to learn what the term herd immunity means. I was wondering for our audience if you could, A, kind of give us a basic explanation of herd immunity, and then B, is that something that eventually we're looking for that will apply to the eradication or at least reduction of coronavirus?
Yes. So basically what herd immunity or community immunity means is that you have enough people who are now immune to this disease so they can't catch it and transmit it to other people, so that basically it stops the spread. And the percentage you need for herd immunity or community immunity depends on how infectious the virus is and how easily it's spread. Some projections are, in order to achieve community immunity with this particular virus, probably need about 80% of people to be immune. Now, the problem right now that we have is that the only way to get immune to this virus is to actually be infected and then recover. And so right now, that's the only way. And if we were able to develop a vaccine, then we could have another way, especially for our seniors who you don't really want to get the virus, to be able to develop that immunity. Unfortunately, any sort of vaccine for this virus is at least 18 months away. It's because of the safety and efficacy studies that would need to be done, and that would be if everything goes just right. So what we need to do now is what we call social distancing, stay at home except for essential services, to try to slow the spread of the virus so we stretch out the infection. We don't want a whole bunch of people infected at the same time. And then what will happen, a certain percentage will end up require hospital care, and then that could overwhelm our hospital system if too many people were sick at the exact same time. So by doing what we're doing now, asking people to stay at home, telling people to, stay away from each other. I said we need to be together apart, so we need to support each other, but trying to stay away from each other in a way that prevents the spread of this disease. That and then we stretch out the rate of spread of this disease, then that will allow our healthcare system, the people working in the healthcare, the hospitals, et cetera, to be able to manage the number of people who are sick at any one time.
So if we just take a typical Sacramento family, I'm going to say a family of four, and they're put on, like all of us, we'll give 2-week time limit. And that family has done all the proper protocols. They've stayed at home. They've protected themselves. And whether or not they're asymptomatic or nothing shows, are we to believe that they are good going forward? Not that they can go out and about, but just would they have kind of cleared any hurdles? What would that family feel like in 2 weeks from now? Again, whether or not they were asymptomatic or just no signs of anything.
So, first of all, this is going to take a lot longer than 2 weeks.
Okay.
Yeah. I have to break it to people. We're talking months and months. We're still trying to figure out as we go along, because we're still gathering more and more information. We're learning from what happens in other countries. We're gathering more data about that. It'd be great if we can get more testing so that we could better identify who has the disease and who doesn't. We are still behind on that, and people are working on that. But basically, if someone stays at home, hopefully they're not getting the disease. If it does spread in their household, it depends on, there could be people who basically catch the disease and infection, and depending on their age and so forth, that they may not have any symptoms. Some people may have symptoms. But what we are trying to do is trying to slow the spread of this disease, particularly trying to protect the people who are most vulnerable. I will point out, though, is that so sometimes people are saying, yes, the people at higher risk of death are seniors over 65, people who have pre-existing heart, lung disease, diabetes, who are immunocompromised. But even younger people, can end up in the hospital. And what we don't want to have happen is have so many people in the hospital at the same time that people can't get care, and then then the infection becomes much more serious. So the other thing I want to keep in mind is that coronavirus isn't the only thing that hospitals have to take care of, even during the outbreak. They're trying to do everything they can to limit the number of people. So that's why we talk about so-called elective surgeries, et cetera. But most people are in the hospital because they actually need to be in the hospital, and so there's other reasons people need to be in hospitals too, and so that makes a challenge as well, because that doesn't go away. People who are being treated for cancer need to still be treated for cancer, right? Other types of conditions as well.
A very busy Dr. Richard Pan, state senator, who has a ton of us on his plate, joining us. Just a couple more questions we want to get in, Doctor, from the listeners. Here's one question from Mark. He says, my daughter got tested at Sutter Urgent Care about 2 weeks ago. They came back with a result of influenza B in less than half an hour. Why is it that it takes so much longer to get results for coronavirus?
Well, we're working on various testing methodologies. You need to be sure that the test is accurate. So I think people are trying to work on rapid tests like we have for influenza. Unfortunately, we don't have them yet. I think there's been some prototypes that have been developed in other countries. So we are working on the testing piece right now. Admittedly, we are behind. We should have been a little farther ahead, but we can't wind back time and correct the past mistakes. What we can do is move forward from here today, and we are working to increase our testing capacity. There are 2 commercial labs, Quest and LabCorp, who are now doing testing. Certainly our public health labs have been doing testing. UC Davis is working on being able to do testing as well, so they've been developing their own tests, and hopefully we will, we are increasing our testing capacity, and we need to try to do that as quickly as possible, but clearly you need to have a test that's actually accurate, and so that is one of the barriers that we have to work on. We also need to be willing to license tests that other countries have developed as well, and so that's something we need to work on. I understand that we're looking at hopefully doing some sort of pop-up testing, but right now testing is also limited to certain groups of people because of the limited testing. So first priority are people in the hospitals, then second priority are people who are most vulnerable. As I said, the seniors, people who have pre-existing conditions, and then people who have direct contacts to someone who's known to be positive. Those have been the priorities for testing. So it's frustrating, but right now if you have symptoms and you think you have the disease, that doesn't necessarily qualify you for testing right now, because unfortunately, due to the limitations in the number of tests we have.
Dr. Payne, I was sent one here on Twitter. They're seeing the news on what's going on in China, or what's gone on in China, what's going on in Italy, and asking, are we ahead as the United States of where they are? Are we behind, of where they were?
Well, that's why the governor announced an all-state stay-at-home order. That's why we already had that in Sacramento and also the Bay Area. We are trying to get ahead of this. We do not want to see what happened in Italy happen here in the United States, or certainly here in California. And so I do want to point out that the success of our ability to keep that from happening depends on each one of us doing what we can to basically stay at home and socially distance, realizing that some people have essential jobs to do, and also that you need to go get groceries and do other types of things. But we can all take the steps that we can to try to limit the spread of this disease, and that means people trying to stay at home as much as possible, or at least stay away from each other. Don't do play dates. Don't go to bars. Any that are still open should be, basically we need to not be gathering together, at least in reality. We can do that virtually. That's fine. We need to each do our part to prevent the spread of this disease. Same time, as I said, try to wash your hands frequently, try to protect yourself. But most importantly, our seniors, the people who are most vulnerable, we need to protect them. If you happen to live in a household with someone who is vulnerable, you need to be extra careful. People who are vulnerable, they need to be extra careful as well. It's particularly important for people who are vulnerable to stay at home. And it's something that all of us need to embrace because, while the governor and, our mayor and our city, county leaders and et cetera can all ask people to do this, it's something we all need to embrace ourselves and do what we can to try to limit the spread of this disease. In the meantime, we are working on policies to try to help people out. I know that this is hard, right? People need to make a living. They need to pay their bills. They need to take care of their kids. They need to take care of their parents, right? And we need to try to figure out what we can do to help people out in doing this so that everyone can do their part to slow the spread of this disease.
Final question, Dr. Pan, and I'll make it a two-parter here because I imagine one of them is probably fairly quick to answer. Number one, is there a specific temperature that could inhibit the virus in regards to your indoor climate control? And the other one, based on some of the things I think we've talked about as far as timelines for spreading, perhaps a vaccine, et cetera. Another person asking, could we be looking at quarantining and social distancing for somewhere around 18 months?
Okay, well, first question is that I am not aware of a particular temperature that you need to set your home or your office that would either slow or increase the spread of this disease. So I have not seen any research around that. And then regarding the amount of time we would need to essentially social distance and stay at home, that is still to be determined because, as I mentioned earlier, some of the modeling that has been done, so people have tried to run modeling scenarios, taking information we have about our communities and what we know about this virus, indicates that this probably will take months. How many months depends on. We're going to learn as we do this too, right?
Right.
And to a certain extent, the virus may spread until we achieve that community immunity level. That's certainly one of the hypotheses. Having a vaccine available will help us sort of round out, if we're successful in slowing the spread, the number, to achieve that level of immunity without having to get people sick. There are hopes, but we don't know for sure because it's a brand new virus. But this class of virus tends to slow down in the summer. That maybe that will help buy us some time when we head into the summer months. But there's no guarantee on that. We hope it is. I don't want to promise anyone anything. But then these types of viruses then tend to come back in the fall. So we'll have to see and learn and do what we can to limit the spread right now. And if we are successful, hopefully we will also both ramp up our testing abilities, and also hopefully if the virus will slow during the summer, that will buy us some time to figure out a different kind of strategy for the fall that hopefully is less restrictive, where we can be more targeted. But for right now, we need to all work together, support each other, have everyone do what they can to limit the spread of this virus and keep this virus over the next, I would say, at least 8 weeks from accelerating and basically overwhelming our healthcare system. Yeah. I will make note that all the actions that we're taking today and over this past few days, we will not see those effects probably for a couple of weeks. And I just want to say that because what will happen is that next weekend people may go, oh, look, the cases are still rising, right, rapidly. And that's because people who were exposed recently, they will develop symptoms about a week later, maybe a little less. But so we are still going to see a rise in people who are at least expressing symptoms. And then also if we do get more testing, we'll see more results from tests. And over the next week or two, please don't look at that news and say, oh, it's not working, I'm giving up.
Well, great information, Dr. Richard Pan. Thank you so much. We look forward to talking to you next Friday as well.
Yes,
Thanks, Doc.
Thank you.
Thank you.